Like it or not, scars are part of every plastic surgery procedure. The difference in plastic surgery and regular surgery is that we try and hide scars in areas where you can't see them. But inevitably, we end up dealing with scars that don't heal the way we want them to. So in this episode of the Trillium Show, what we're going to do is talk about the whys, why we get scars, and the hows, how to prevent them, and how to treat them once we get them. Welcome to another episode of the Trillium Show. I'm board-certified plastic surgeon and author of the new book, The Art of Aging, Dr. Jason Hall. You can click on the link in the show notes to get a copy of that. So, any time the skin is broken, you are going to get a scar. There is no such thing as scarless surgery. There are techniques that we can use to make the scars less visible. There are techniques that we do use all the time to try and hide scars in areas where they're hard to see. But doing surgery, doing invasive surgery, which is every plastic surgery procedure known to man, without a scar is impossible. Now, let's talk a little bit about scars themselves and the factors that make for good scars and bad scars. One of the biggest problems that we see with scars healing in a way that we don't like is tension. And unfortunately, in plastic surgical procedures, what we're doing as surgeons is changing the way things look by stretching things. Think about tummy tucks, think about breast augmentation surgery, think even about facelift surgery. We're moving things to fight gravity or to tighten the skin in the case of a tummy tuck. And tension is a kind of part of what we do. So we want to try and take tension out of the mix to make a good scar. Question is how we do that. And the answer is we put tension on things that you don't see. There's a layer of tissue underneath your skin, pretty much in every part of your body. It's called fascia. It's a very thick connective tissue layer. And when we're pulling things, and I'll use a tummy tuck as an example, we put all of our tension on the fascia. And so there's sutures on the inside, bunches of sutures on the inside that you never see, you never feel, you don't even know that they're there after you've had surgery. And we use those to pull those tissue layers together so that the skin at the surface is just touching, is kissing. So there's tension on the fascia, but no tension on the skin. And removing tension that way is the way that we kind of take tension out of the mix as forming a bad scar. Another thing that we can use to help mitigate scarring is to close that incision very precisely. We want those skin edges. I talked about the skin edges kissing together. We want those skin edges touching, and the stitches that we use in the skin are merely used to line up those skin edges so that they are exactly next to each other. And when they heal, there's not ridges or gaps or, areas where your body's trying to fill in a hole, because that creates scarring too. So eliminating tension to the best of our ability is one way that we keep our scars looking nice. The other way that we do it, and I talked about this at the very beginning, is we put scars in areas that are tough to see. When you look at somebody and you're looking at somebody, from a distance, there are areas where there are shadows that naturally occur. Think about, in front of your ear, where the skin of your face kind of changes both in texture and color and goes up onto your ear, is a natural break point for your eye. So your eye is not going to perceive at that little break point naturally an incision. And so when we do a facelift, we put incisions right in that little break point in front of your ear and then kind of hide them behind your tragus, which is this part of your ear, to help those scars be less visible. Now, if you look closely, you're going to see them, but from a distance, from a conversational distance, they're tough to see because we put them in the right place. Same thing with breast surgery. If you think about a breast augmentation, that incision is in your breast crease. It's a hidden incision. Abdominoplasty surgery, likewise, that scar, ideally, if we do the procedure right, is hidden in your panty line. So now, when you don't have any clothes on, you're going to see the scar. But when you're dressed, when you're in a two-piece, when you're out on the beach, it's an incision that is hidden. And so those are, planning those incisions, making sure that those incisions end up where we want them to, is another way that we can mitigate scarring and make surgery look like there wasn't a scar there. You hear about people on the internet talking about scarless facelift surgery. Scarless facelift surgery doesn't exist. There are scars somewhere, you just don't see them. In scarless facelift surgery, typically those are in the hair, those are behind the ear and the hairline, which are tough to see. We don't have an incision in front of the ear. But for any operation, there is going to be a scar somewhere. There are really two main things that go into scar healing. One is technique, like we talked about. The other is genetics. And the genetics part of it is something that we don't have any control over at all. And that's how you personally heal. When I'm talking to patients in consultation and we start talking about scar position, scar location, how, what to expect, what I tell people is that I essentially do the closures the same way every time. We try and get the tension the same every time. Use the same sutures every time. Use the same post-operative care regimen every time. That being said, I've got scars. Every plastic surgeon has scars that don't look good. Most of them look really nice. Some of them look okay, and some of them look terrible. And we have to do something about it. And the looking terrible part really, if everything else is the same, comes down to a genetic component. And so that brings up the question, we have a scar that we don't like. What can we do about it? And there's a range of things that we can do, from the simple to the complicated. Simple things really comes down to, an old adage that I think everybody's probably heard, that an ounce of prevention is worth a pound of cure. And so preventing a bad scar is a whole lot better than trying to treat a bad scar. And so in my practice, every patient that I operate on gets topical silicone immediately after the tape comes off. And that's typically at a week. There's no sutures to remove for the majority of my surgeries. Certainly none of the breast and body surgeries. As soon as those surgical tapes come off at a week, we start topical silicone treatment. And the silicone works by helping to reorganize the collagen that's in that scar and helps to fade it, to keep it from overgrowing, which is what gives you kind of nasty looking scars. Despite all of that, we can still have some healing difficulties and scars that are red, scars that are raised, that don't look good. The first line treatment for those typically are steroid injections, where again, we're trying to modify that disordered collagen in those scars and flatten those scars out. We can also use some light treatments to help fade the red out of those scars. If that doesn't work, then we're kind of left with, the solution that most surgeons have in their back pocket, which is to just revise the scar itself. Once things have healed, if we've got tension that has contributed to that scar healing, we can go and remove that scar, release some of that tension, and some of the tension is going to have gone away naturally because the skin kind of relaxes as it heals, and we can redo that scar and essentially start over. Now, that's a last resort, but in some patients, that's the best option. So preventing scars is ideal. Treating them medically is kind of the next step. And then the final step is surgical revision. Now, what happens with a scar that you get that isn't the result of surgery? That's the result of an injury. That's the result of a, laceration, or an accident. Those can be a little bit different. I like to tell people, when you fall and break your arm, you can get an x-ray, and the x-ray shows you the broken bone so that the surgeon can then go in and fix it. When you get a laceration, things are a little bit different. We can't look at the skin and tell what parts of that skin, what edges of that laceration have been injured. This is especially true with lacerations that are caused by tearing. So a fall, you see boxers that get cuts over their eye during a boxing match from tension, from tearing. It's very difficult to know what those skin edges are going to look like when we go and repair that laceration. And a lot of times the doctor book treatment is to remove the edges of that laceration so that the edges are nice and healthy. That can be a big problem on the face where we don't have a lot of extra tissue to work with, and we're trying to preserve everything that's there. And so, obviously anything that really looks nasty, we're going to remove, but then we want to do the same thing that we do in surgery. Put in sutures underneath the skin, take tension off those skin edges, reapproximate, put those skin edges back together precisely with little bitty stitches. And then the key, especially with facial surgery, is removing those stitches early. Facial stitches should never be left in more than 5 or 7 days, because if they do, you're going to get those railroad track scars. And we see those a lot. Those can be really challenging to treat. Laser is a great treatment option for those, but once they're there, you really can't ever erase those. The treatment for, non-surgical scars, so accident scars, cut scars, is really the same as the treatment for surgical scars. We start with a steroid if it needs it. We use silicone early if we can. We start with steroids. We can use laser. And then finally, good old-fashioned scar revision, it can be a very valuable treatment option to help minimize the appearance of a traumatic scar. So with scars, it's important to remember that there are multiple components to how they heal well, and what to do about them if they don't. The most important is remember we said at the beginning, prevention, an ounce of prevention is worth a pound of cure. So preventing a bad scar really starts with making sure that whether that's an injury or a surgical scar, that wound gets closed appropriately with stitches below the skin that are taking tension off the skin, and then very precise closure of the skin edges. That by far is the most important part of it. Then you get into treating scars if they don't heal really well. And those treatment options start with topical silicone, move up to steroid injections, laser treatments, and then finally scar revision, which takes you back in a circle, back to closing that incision properly, taking tension off the skin, putting the skin edges together correctly. So if you've got an injury, if you're planning on having surgery, talk to your surgeon about the scars, where they're going to be, and what things you can do to help prevent the scars in the first place. If you've got any questions, shoot me a DM at Dr. Jason Hall. Shoot me an email, info@drjasonhall.com. If you've got any suggestions for other shows or topics you want to see covered, shoot me a DM or shoot me an email. Thanks for listening. We'll see you on the next show.